Count Corley, it is important that we realise why this motion was put down by our party. It was not, I can assure Minister Reilly or Rabbitte or any others, for political opportunism. Far from it, actually. We did it because, whether the government deputies accept it or not, confidence, I'm afraid, has been lost on the ability of this minister to manage the health service. And despite using Bill Clinton comparisons last night, and he's no Bill Clinton, I remind you, it would be more in line for the minister to look at the facts that clearly speak for themselves. Labour ministers within his department and in government generally had not even been informed about the most recent announcements on further cutbacks because of Minister Reilly's inability to deliver the budget that he had promised. And when he comes under pressure, he hits out at the Croke Park Agreement. He hits out at sick pay. And last night in his speech he said it was ironic, of course, that Fianna Fáil was bringing forward the motion, ignoring any accountability he had himself in his own department. Minister Reilly has denied that he cleared these cuts. He has denied that he hid behind the HSE and let them make the announcement. He has denied that he did not do media interviews, despite the fact that he was asked by numerous outlets on numerous occasions. And he then had the audacity, of course, to blame the opposition for the fact that disabled people were protesting overnight 3 weeks ago, having said that his message was lost, and he found it impossible to communicate clearly because of the fog that had been created to them, the fact that they would not lose their service. How could he do it anyhow? He only had one interview, and in that you decided to throw in the Croke Park Agreement. But after that week of negative publicity and more chaos, particularly from the Labour Party chairman and others, you met your cabinet colleagues and no doubt were told to sort out the mess that you had created. You then announced the U-turn. The Taoiseach congratulated you on your bravery. And then you did a primetime interview and denied that you'd done a U-turn at all. And I remember that weekend, around the local radio stations throughout the country, you couldn't get into them with the Labour members queuing up to say what they were going to tell them when they got back and how they would be reversed and not. And the same Labour Party members would be tripping over themselves voting for him here this evening. There's a pattern here. There's a pattern here. Blame anyone. Blame everyone but yourself. You're a minister now for the last 18 months, and you've been very busy relabelling and re-announcing initiatives that were started by the last government. You spoke last night a lot about irony, yet you had no scruples blaming Micheál Martin, who had left the department in 2004, which is 8 years ago. And I'd say little about the previous ministers, that the list for which Minister Noonan gave us, but he failed to mention his own tenure when he set up Tenton himself and had to get out of it fairly quickly. Minister Reilly also spoke about being a GP last night and that he came into politics late. But he didn't elaborate on how steeped he was in medical politics for many years, in the IMO. And there is, of course, nothing wrong with that. But there's an irony in the fact when he speaks about the delays in negotiations with the IPHA on drug costs and the consultants on the re-implementation of the 2008 contract, or the fact that he presided over the most lucrative deal ever received for GPs under his presidency of the IMO. And this tied in with his rallies around the country before the last election, where promises on Monaghan, for example, were made by Minister Reilly for nothing, only blatant political gain, knowing full well that they were not implementable. Then, in addition to that blatant broken promise, we had the Taoiseach and his promise in Roscommon Hospital, which he denied at first until the tape was produced and he had to retract. And as for Minister Rabbitte here last night, asking that Micheál Martin should crawl under a stone in the burn because of what he had done to the country, nothing, only another typical headline-grabbing superficial account of a global European economic crisis, who rarely speaks about his past, whether it be in the Democratic left or the Workers' Party. We won't get any retrospective comments on that, of course. The minister also commented last night on how patients are always at the centre of his decisions, of the decisions that he takes. Why then did he cut thousands of hours of home help? Why then is it his inaction on the budget, on his budget, which will result in ward closures all over this country. These are the facts that Minister Reilly will not be able to contradict or twist to his own advantage. The European Health Consumer Index regularly assesses patient services across the EU. In 2005, for example, it ranked Ireland in terms of the quality of its health service as number 25 out of 26 European countries. However, 4 years later, following the introduction of the HSE in 2005, Ireland was ranked 13 of 33 countries ranked. And they actually commented on the fact that the creation of the HSE was obviously a much-needed reform. And ironically, again, before Minister Reilly's time in this House or in Fine Gael, it was Fine Gael that supported the formation of the HSE. And I quote one Deputy Olivia Mitchell at that time. "I welcome the reform," she said, "as does Fine Gael, and we accept the need for a more centralised administration system and for a clear chain of command through the health service, which had been lacking up to then." You said last night that you did not get rid of the HSE. Yet, to great fanfare, you announced its abolition of the board as you wanted to be in charge. And you replaced the board with officials. So we now have the farce of the CEO on the board writing to department officials about budget concerns, with no one accountable. This was your decision, no one else's, Minister. And there's no doubt that the HSE structure was not perfect, but patients' outcomes have improved under its direction. So whether it's accepted or not by deputies across the floor, developing a modern integrated health service is a difficult journey. But at least the last government had bedded down the right policy of putting patient outcomes at the centre of our party's health policy. And I tell you, Minister Reilly, what it is you're doing. You're talking about reform for reform's sake and for political gain, while chaos continues to reign across the health service. Dismissing the board on your appointment was obviously your choice, but it's your biggest failing in not putting governance structure in its place. A massive drift was allowed to develop, not only with budget deficits, but also on reforms that the government promised before and after the election. One of these commitments is the introduction of a free GP care for patients with long-term illnesses. Yet we were only told by the media a few days ago that there are legal issues, as long-term illness is seemingly hard to define on an income basis. Why then was this initiative announced numerous times before the legal issues were checked? Is it a smokescreen? And it's worth noting for the record that the IMO have yet to be consulted in relation to this initiative. This flip-flopping is causing confusion amongst those with long-term illnesses, and it's making them lose confidence and become very cynical about political promises such as those you have given. Staff in the health service face challenges every day, but they are seriously concerned how directionless the health service has become. As early as last April, the All-Party Oireachtas Committee on Health was informed that budgets were overrun, in some cases up to 10 million. The regional hospital in Limerick was 9 million over, Cork 5 million, Galway 7, and Dublin hospitals were up to 9 million overspent. Yet there was no actions to correct these deficits even at that time. And these overruns added to the savings that were not met but promised at last year's budget. And because of the legislation not being produced in time, or negotiations not being finalised on drug costs, this tardiness will only add to more cuts on stretched services. Finally, Count Corlett, I firmly believe that issues in the health service should be debated openly in this House. And there's no point in having a budget that is made on what were false expectations, as this only adds to the pressures that the service was under. And I believe that this House should support the motion.